Hi, this is Dr. Arun Kannan, orthopedic surgeon from Apollo Hospital, Chennai. I specialize in hip and knee surgery, and one of the common questions that patients who are about to undergo or have undergone a knee replacement ask is, how long will my knee replacement last? So I'll be answering that question in this video. Knee replacement has been an extremely successful procedure for the last 50 years or so, and millions of people have had knee replacements and have done very well. And this is world over, not limited to one region, one country or one surgeon. It has done exceptionally well. And one of the reasons is it has lasted a long time for many patients. But to put a number, we have excellent data from what we call registries. Many countries, especially in Europe and Australia, have maintained what is called a registry. List of all patients who had knee replacement as well as hip replacements, and they have followed them for many years. And when we see these data for the last 20-25 years or so, it is really a pleasant surprise. I wouldn't call it a surprise, but it is a pleasant finding to know that what we believed all along is true. If you look at this Australian registry data that has data on thousands and lakhs of patients who had knee replacement, it shows that at about 20 years, less than 10% of people who had a knee replacement have required a revision surgery. What it means is, if 100 people were operated today, and based on this data, if you follow them for a period of 20 years, more than 90% of them would still be happy on their knees, not requiring a revision or redo surgery. So this example, you can see this lady, she was in her 40s when she had both knee replacements done and these lasted for over 19 years for her. At the end of 19 years, I had to revise both her knees because they had become loose over a period of 19 to 20 years. And you can still see that the implants look fairly good, not much damage on the implants. It is the bone under the implant that has become weak and given way. So we replaced or revised both these knee replacements, and again she is doing well at this age. So what are the factors that have contributed to this success? The material of the knee replacement has been standard, and it has proved to be extremely durable for the last so many years. The femur component or the upper component of the knee replacement is made up of an alloy called chromium cobalt alloy. This has very good frictional properties and it has served very well. The lower portion is usually made of titanium. This is called the tibial component. In between these two components is a specialized kind of polyethylene. So these three have been a combination that has worked really well for many years, and this is attributable to the success of the knee replacement procedure. The other thing, or more promising or optimistic thing that we get from this registry data is that these data have been collecting data for the past 25 years or so, meaning these include many knee joint replacements that were done in 1997 to 2005, and since then multiple small refinements as well as major technical breakthroughs have been done in knee replacement. And with this, we only expect the life, longevity and the functionality of knee replacement to go higher in the future. Meaning, compared to even this registry data, what we do now, we expect them to last longer and do better. The polyethylene that I've been talking about has changed considerably over the last 15 years or so. We have used something called a highly cross-linked polyethylene as compared to the standard polyethylene that we used earlier. This has better frictional properties, lower wear rate, meaning it gets worn out less with time, and therefore it is expected to last longer. Other minor changes in implant design have been continuously made by the medical industry, the medical devices industry, and these have made the knee more functional, and we expect them to last longer with time. The latest or the recent advancement has been the robotic technology. So earlier in 1990s or early 2000s, most of them were done using conventional instruments which were not as refined as what we have today. Now we are having cutting edge technology to give excellent alignment to the knee replacement implants, which is the robotic technology. In robotic technology, we are able to place the implants at exactly the angle at exactly the positions what we aim for. We match it to the patient's anatomy, we call it 3D shape matching, we match it very well to the patient's bone and we are able to insert them. So compared to even 20 years back, this has been a major advancement over the last 5 years or so, and we expect with robotic technology, all knee replacements done with technology assistant, they will be having a better alignment, they will not have outliers, meaning they will not have mistakes that a surgeon can make. It eliminates or almost reduces the surgical errors by a great measure. So when these are done accurately using technology like robotics, again we expect these knees to last even longer than what they have done over the last 25 years. So in summary, knee replacement has been an extremely successful procedure. Even historically, even 25 years back, the knees that were done have on an average lasted 20 years for 90% of patients. With newer materials such as highly cross-linked polyethylene, with more accurate surgical technology such as robotic technology, we expect them to last even longer. Thank you.